after seeing so many wonderful cases we have seen in the morning, I think by now we don't have doubts whether homeopathy works or not. I wish I had seen this 25 years back when I really started changing myself from an allopath to an homeopath. And the person who converted me into homeopathy was another allopath, and that was my father-in-law. He was a pediatrician and a very well-known pediatrician, Dr. Athavle. And when I got married, I saw that he had hundreds of patients. But he would spare time, take some time to explain to patients, and he would give homeopathy. And I said, why are you giving homeopathy when you have such excellent results with allopathy? He says patients come again and again. They fall sick, after some time again they come with the same problem, and he is a very spiritual man basically. And I really look up to him, he's almost like my guru. And he really impressed me when he said that this is not treatment, it is just management, management, crisis management when somebody comes when he is not well. What we have to do is, we have to see that they don't fall ill again. And that is how I began, and then he recommended me to start learning homeopathy, and I really was drawn into it, seeing the results, and I was really very happy about it. Now, I am a psychiatrist and I am treating very often psychiatric patients. My wife is also a psychiatrist, and we both are treating, and she also does homeopathy. We don't have a heart to give allopathic patients to our patients. It is not possible. I would just think of myself, if my child at that age would come, and if I were to give allopathic medications to my small child, 5-year-old, 6-year-old, would I do it? No. And especially psychiatric medications which have to be given again and again. And some of the medications we give really are stimulants like amphetamine, which is also abused by many people as adults. So it was really difficult for us. So we were doing a lot of counseling before, and then with this homeopathy, really I think there's a big change. Just what homeopathy does, I think I can give you a small example. Let's say if you have two children, and the two children are quarreling at home, and they are making a big ruckus, and there's too much of noise, and they are really fighting and bringing the roof down. What does the father do? He comes, becomes very firm and just says, shut up now, nobody is going to talk, everybody go to your room, I don't want any noise anymore. And everything is quiet. The children go to the room. It looks like the problem is solved. But has the problem really solved? Because both the children are internally boiling, the mother has her issue, the two children have their issue. And then the mother goes to each child's room and starts talking. Tell me, what is your problem? What exactly are you feeling inside? And she goes deep into him or her and tries to find a solution there. Homeopathy is like mother, and allopathy is like father. I don't say fathers are not needed. Sometimes we need to be strict. Sometimes when things go out of control, we do need to put our foot down and be very firm. But that alone as a solution, I have doubts. I think we have to address the deeper issues of that child. And this is what homeopathy does. Actually, if you see the history of psychiatry, it started with the same thing. We had the whole psychiatry started with Freud and his contemporaries, and the whole idea was to go deep into the psychology of the person. Go deep and see what is the genesis, what is happening inside. And they really understood a lot of intra-psychic dynamics, what is really happening inside. And that was how psychotherapy, the birth of psychotherapy took place. Unfortunately, psychotherapy by itself could not give very good results. Sometimes you have an idea about what the patient's problem is, and then for 2, 3, 4 years you go out, and after 3 years, sometimes they are better, may not be better, and only helps you in psychological problems, not in physical problems. You need the person to be very psychologically minded. So there were a lot of disappointments. So we had good theory, but no results. And then in 1950, there was the first medicine which came out, psychiatric pill, and then psychiatry started getting into the medical model. Till then we were like outcasts, psychiatrists out. And that is generally the attitude towards even psychiatric patients. Generally they are shunned out. Oh, psychiatric, no, we have nothing to do with it. Even if you have to go to a psychiatrist, even now many might say, oh my God, no, don't talk about going to a psychiatrist. So this is generally a little leprous feeling we have towards this particular science. But in 1950 and onwards, we became very, very medical. We started prescribing pills, and then we became brothers with pediatricians and surgeons and physicians. They welcomed us because now we had some drugs by which we could do. But this is really putting a lid over the problem, not really solving the problem. I'm really happy because we saw some wonderful cases today, one by Dr. Dinesh Chauhan, and I was very happy seeing that autistic child and the amazing results which you had with that case. And this wonderful case by Dr. Sujit Chatterjee, it was really fun watching that child and the amount of restlessness that child had and how he became very quiet. Now, what would we have done with an autistic child? I don't know whether we have any medications or anything for that. Unfortunately, just imagine one of us having that sort of a child. It's a nightmare, and it's so difficult to live with it and with no solution. And we see so often such wonderful results in such difficult cases, almost like it's a handicap for that child, a lifelong handicap. And with that restlessness, again, it's like you cannot do anything but to give 100% attention to that child. So I brought some other case, one case which is little different from the two which you have already seen, and it's a case of a 6-year-old boy. He came with obsessive compulsive disorder. What is obsessive compulsive disorder? Obsession means one thought which repeatedly comes in your mind. Very often it is something which, not very often, it is always something which you don't want. Something which you don't want, and it goes on coming, and then you are very upset about it. You fight it, you say, I don't want it, I don't want it. But this is how our minds are. Our minds are monkeys. The more you say no, the more it wants. And then the thoughts come more and more, and it is a very crippling disorder again. Very often you see patients with this disorder in adult life, and then it lasts almost lifelong. Most of the psychiatrists would say we cannot guarantee it will be gone, and usually it will last. And with time it only becomes worse. Now 6-year-old boy coming with this, I would not ever give allopathic, but I thought, let me understand this boy. So this is his problem. I imagine dirty things about girls I see their photos in newspaper, I feel like kissing them. Now he sees these children talk in school, now they are exposed to televisions, to movies, and then he was seeing those things, he was getting a thought about it and at the same time fighting it. I don't want to be bad, God punishes bad children. This plight. Child who loves the parents gets the thought that I will kill my parents. And he wishes, he thinks that I am going to kill them. And then he gets all these dirty thoughts. Not only about mother and father, even about Mother Mary. I see that photo and then I think, oh, she is naked. It's a big torture thinking all the time of thoughts which are so troublesome to you. Now, a lot of counseling was done, lot of psychological therapy, they tried, nothing happened. And then they came to me, and just in 10 days, without any counseling done to the child, I would like you to see the follow-up. Just 1 minute, let's see the case, 1 minute. So he is very loving, this is what the history we got, very obedient, very attached to me, the mother says. He is very particular about his works. His books are always taken as example to show other students. So he is an example, and for him getting these sort of thoughts were too much. He is very serious type and not very carefree. He was never like this until a few days back. We were at a friend's birthday party. They didn't tell us that it was an adult party, and they made some obscene cake, and they were talking crap like I don't cut the cake, I just lick it. And we were shocked. My husband sent the kids into the room, but already they had seen everything. And he started talking like this after the party. I don't want to think all bad things. I'm feeling very bad. I know you will stop loving me because of this, he tells the child. And then, of course, all the usual homeopathic history we took. What happened, as I was telling you, that there was a lot of psychological theory, but we did not know how to use it. And then the whole trend changed. It was almost, we split. There was a divorce from the old school, and a new school started, which is the medical model. And they could not see eye to eye. In fact, if you'll see most of the new modern psychiatric books, they don't even mention, they do mention Freud, but hardly anything about all the intrapsychic theories. But homeopathy has an answer. Where allopathy failed, homeopathy has an answer. We can take all those stuff, all that intrapsychic stuff, but now with these whatever homeopathic pills we have, we can give a solution. The solution which they did not have at that time, we have it because of our homeopathy. So these are some of the things. We saw already a case of attention deficit disorder with hyperactivity by Sujit Chatterjee. Now what happens is the child is restless and we are always looking for reasons outside. Most of the allopaths will say it is probably this is a minimal brain dysfunction, or they will say that you are probably eating some canned food with preservatives which is causing this sort of problem. But now we realize that this child had an inner energy of an animal, and that animal's restlessness was seen in the child. So what we were seeing as restlessness was actually the energy of that animal which was manifesting through this child. And when you take care of this, then you see that there is a difference. Then we have concentration and memory problems, reading, writing difficulties. Day in, day out we see these cases, and with excellent results, and which allopath has no answer for this. Autism. Now we saw this wonderful case of Pepper by Dr. Dinesh Chauhan, and what did we see is that the child was completely closed like in a cocoon and was not talking or communicating with anybody, and with few doses of his remedy and in a year's time there was a remarkable change, and that boy started talking. He was given a plant remedy. He was given a plant which is a very primitive plant, and more the primitive plant, the more sensitive that plant is. We heard from Dr. Rajan Shankaran that plants have sensitivity and reactivity. So now this child, being very sensitive, too sensitive, just shut himself. He closed himself. Now we don't understand that. We just see that child who is completely closed within and not coming out. He is not coming out because everything is too much for him. He cannot handle it. So he just knows one way how to cut himself out from the environment. But when you give this homeopathy, he starts opening up. Now, there is no other way you can treat. This is the only way one can treat these children. This we have to know. Then we have a lot of fears. We again saw some cases where there were a lot of fears. Exam tension, sleep and appetite disorders, thumb sucking, nail biting, pica, shyness, social phobia. Day in, day out we see these cases, and we are very, very happy doing homeopathy because it is really without doing much, without really even psychologically going deep into the child or trying to give him all psychotherapy. Just by those few pills we can bring a big change. Like for example, this boy I showed, we didn't have to really counsel, because every time you go on talking, now do you get sex thoughts, do you get sex thoughts, you are actually creating that sort of a imprint in his mind. We just gave few doses, we don't see that child anymore, and it's almost like that whole thing, that whole issue is erased out of his system. Thank you very much.